When it comes to the stakeholders and the model or theory of special education that we're considering for case study number 4 with least restrictive environment, there's not as much detail here, but we can make some compliance decisions and some recommendations and start to dig in a little bit deeper, especially considering the fact that we need data and discussion documented behind these changes in least restrictive environment and placement and setting. For starters, we need to make sure that there's collaboration happening, access, attendance, and good practice, best practice for relationship building happening between the parent, the staff, the teachers, both general education and special education, the social worker, the principal, and especially the family. Something is happening that we don't have a lot of details about in this case. We know that mom and dad or parents, family members, whoever those are, canceled the meeting in November of 21, the IEP meeting, in which we were trying to get together to put some solutions in place for what's going on here. So we know something is going on, and we need to make sure we've documented and assured that all stakeholders have an opportunity. It's hard to determine which model is really in play here, if it comes from the medical model, the social model, or the charity model. I think the model that you choose to view it, and that would be kind of a personal piece, both from the stakeholders involved in the case, but also you as a professional reviewing the case. The model that you choose is going to really put a lens on this. For example, from a medical model, this student likely has some kind of behavioral impairment that we have not maybe gotten enough data and diagnostic information about yet. In the social model, what are those barriers in place? What is so unsettling and inaccessible for this student in this school and in these classrooms, so that he or she can't access and can't be able to be even present in those settings with his or her peers? And then the charity model, this case kind of breaks our heart a little bit. We want to know more about what's going in that family. Why are mom and dad or family members not able to even attend an IEP? What's going on with the relationship with the parapro, where somebody doesn't want the parapro working with the kiddo? Is there something we are not seeing, we don't know about? What are the questions we need to ask? What other data do we need? And what discussions do we need? Kind of based on what lens you have and how you're looking at this. Also being empathetic, relationship building, and collaborative, and considering the different models that the stakeholders themselves might be bringing to the table.